two, three. For everybody joining, let me just do this again very quickly. We're doing this Corona series because I know a lot has been said in the media. There's a lot of speculation. There's a lot of fake news also being forwarded on WhatsApp groups, on social media. And we thought we'd talk to physicians in Lebanon to talk and to see what they have to say about their own experiences in the country. Dr. Sharara is an assistant professor of pediatrics and pediatric critical care at the American University of Beirut Medical Center. And she's also the founder of Parent Wise, which is an NGO that helps parents answer the big questions about their children and really empower parents to get free, reliable resources on how to deal with their children growing up. Because I know Dr. Sharara gets a lot of WhatsApp messages from her patients, and this was a way for her to also contribute positively and make sure that all your FAQs are answered. Dr. Sharara, thank you for joining us again. Let's test this one more time for everybody who's here. Can you hear me? And how's the 3G working?
I can hear you very well. Can everybody hear me better?
Is everybody listening? Can anybody hear? We're about to listen. The cool thing is that they're all going to be able to tell us. Alisar Karakala just joined. I know a friend of yours and a lovely woman.
I can see a lot of my patients, and I thank them for their support.
Thank you. Youmna Naufal is also here. Karma is here. Karma, can you hear? Rakan is also here, tuning in from Saudi Arabia. Paul, tuning in from Dubai. Fatin, who's a student at AUB.
Okay, I'm
Rachel,
that the sound is perfect.
The sound is perfect. Everybody can hear. Hi, Caroline Fatal is hearing. No more echo. All right, here we go.
All right.
Thank you for joining us. We're going to get right into it. Rana, I had asked you, you know, and I think this is what everybody wants to talk about, and I just want to repeat that question, is that what's marking public opinion today is this notion that children seem to be more resistant to the coronavirus, COVID-19, and less sensitive to it. So what is the truth about that? Because we have seen a few children infected. The numbers are very low, but they seem to have this immunity that adults don't. And I don't know if there's a theory behind this or, you know, what you can tell me about this.
So just before I answer your question, Youmna, I have two disclaimers to make. Okay, first of all, the data on COVID-19 is changing every day. So what we are saying now stands for now. It might change in 2 to 3 days. Okay, so I just want everybody to know that things are very dynamic and they are still changing, and we are learning about this virus every single day. The other disclaimer I want to make is that I'm speaking as a pediatrician here. I'm not speaking as an epidemiologist. I'm not speaking as an infectious disease specialist, which I know you're going to host someone from infectious disease. So I'm just speaking as a pediatrician and as, you know, as a parent and as a mother and, you know, as someone.
And we're learning about this every single day. We're still learning about it. So as everything that we say today is as it stands up till today and what we know till today.
Yes.
And I think that's important to mention because things are going very fast and we're getting news and a lot of information very fast. So thank you for saying that. All right.
So the fact that children seem to be protected is actually a mystery. And it's, if you want, a social, a scientific curiosity to us. So initially we thought at the beginning of this pandemic, we thought that kids are really protected and that they do not get coronavirus. And even if they did, their symptoms would be very low. As we started to learn more and more about this virus, now we understand that actually kids play a major role in COVID-19 pandemic because they can be vectors. So they can transmit the virus. And now there are even some reports that kids can probably shed viral RNA in their stools for 1 month after the infection. Now, we don't know how infectious this is because this is not the major mode of transmission. The other thing I want to mention is that 2 days ago, actually, on March 16th, an article was published in Pediatrics, which is the most prestigious pediatric journal. And this article was out of the Chinese experience. And they describe over 2,000 children that got infected with COVID-19. And out of these children, 6% under 1 year of age were in a very serious state. So they had to be admitted to the intensive care unit. This is opposed to 18% in adults. So the number is still half of that of the adults, but it's still significant.
So you're saying that in China, kids were admitted as severe cases.
Yes. So
during
6% of of infants under 1 year of age needed to be admitted to the ICU.
Okay.
As kids grow older, this percentage goes down. For example, in adolescents, the percentage of severe illness is close to 3.8%. But the one child that died during this epidemic in China was actually a 14-year-old child. So children do get infected. They do not get as sick as adults, and that is explained by several theories, actually. One of them is that children have not been, because they lived for a shorter period of time, they have not yet been exposed to many coronaviruses. We all have been exposed to some coronaviruses, and we have built some antibodies to them.
Mm-hmm.
This new coronavirus, kids have not yet been exposed to it, so they are building new antibodies. And in this case,
better immunity.
And better immunity. In this case, scientists seem to think that the old antibodies adults have developed against other coronaviruses don't match exactly the antibodies of this new coronavirus, and it might lead actually to a different immune response.
All right. We're just going to get a question here from one of our viewers, and then I'll get to the other one. You know, we've talked about children generally, but if some children have low immunity, do they have a higher risk of getting infected or a higher risk of reaction, or that doesn't really matter?
So it depends what we mean by low immunity, but anyone with lower immunity, whether it's children or adults, are more susceptible to infection. And they can get infected in a more serious way if they did catch the infection.
Which is probably why, you know, schools were closed and, you know, everybody's quarantined right now. And I think, you know, we're going to talk about flattening the curve in a second. But a big question that I got when I said that I was hosting you was women who are pregnant, and should they get infected and give birth? Because I know that a baby was born. There was also an article written about a baby born with the coronavirus. What's fact versus fiction when it comes to that?
So the answer now is that we still do not know if pregnant women can transmit the COVID-19 virus to their fetus or to their newborn. So we don't know if there's a transmission in utero or in the afterbirth. So far, there are no babies who tested positive at birth to moms who had tested positive for COVID-19. So it doesn't seem to be a vertical transmission, but we are not 100% sure yet, and things might change. What I can tell you for sure is that we know for now that breast milk does not transmit COVID-19.
Breast milk does not transmit COVID-19.
Does not transmit COVID-19. So if mom is confirmed a positive case, she can still breastfeed. Now, to be on the safer side, the recommendation is one of the two. So either she should express her milk and ask someone who is not infected to give the milk to the baby, or if she really wants to breastfeed, she can, as long as she washes her hands and puts a mask on.
All right. We're getting another question here about, you know, I want to talk about how we present coronavirus to children at home and make them understand without traumatizing them. But I also want, there was a case here of a mother using hand sanitizer on her son's hands, and it burned. So hand sanitizer also, how safe is it for children, or should we stick to soap and water? This is another one that they're asking.
So we can always stick to soap and water. However, it's not as simple as it sounds. Children need to really wash their hands for 20 to 30 seconds. So we actually mentioned it in one of the posts on ParentWise. I recommended that kids sing the happy birthday song once while they are washing their hands with soap. So this is one thing if we're going to use soap and water. Now, you can use hand sanitizers, of course, and they were shown to be beneficial and sanitizing as long as they contain 70% alcohol. Now,
70% alcohol. So it depends
yes,
maybe on the alcohol rate at this point. Right. Okay.
exactly. So the alcohol percentage. So
Hmm.
I'm not sure if this child that had his hands burned, if it was more than 70%, or if the child had any underlying condition like severe eczema or psoriasis or anything like that, that might have led him to get
This
burned.
was a question from Karma Ikmegji. So I think maybe, I don't know if do you have softer hands or not? No. We're getting other questions, but I want to move forward, guys, and we'll get to more of your questions in a bit. You know, is there a way to explain this to children at home to make them understand without the trauma of, you know, the world is going through some apocalyptic disease, you know, following us everywhere. They're
Yeah.
talking about children being out of school till possibly the end of the school year. So there's a lot to talk about. And I think parents struggle with how do you have to explain it other than what you read on the internet and, you know, wash your hands and whatnot.
So I think it's very important to also reassure children. So
Mm-hmm.
really simple reassurance is very important because children do not need to carry this burden. It's really up to us to protect our older people, but also to protect our children from anxiety and from carrying this burden. So I think it's very important to just simply reassure the children that things will be okay, and you know, historically there have been pandemics and we will come
Mm-hmm.
out of this.
We
the
will.
other the other very important factor is to give them some control. So to show the children that if they actually wash their hands, if they actually sneeze and cough into their elbows, they are helping controlling the pandemic. So if
Mm-hmm.
we give them some control, this can also make them feel more important and they feel that they actually want to contribute.
So, you know,
The
make
other,
them speak to them like adults, basically. Speak to them like,
speak
you
to them,
know,
yes, speak to them like adults. Also, it's very important to be a good role model to children. So if they see us being socially distant, if they see us that we are staying at home,
mm-hmm.
if they understand that I have to leave to go to work because I'm a
Mm-hmm.
doctor and I need to take care of other children, I think we are modeling the right behavior.
Right.
So it's not fair, for example, to let children have play dates or invite their friends or like order deliveries all day
Social
long because
distancing means just really social distancing. No play dates,
exactly.
not even one friend, doctor.
I
It's
mean, if it's a really close friend and
yeah.
you are sure that the parent of this child have not been in travel, that this child is not seeing their grandparents,
Yes.
then I think it's okay. But it can really become a slippery slope. And
Mm-hmm.
again, things I want to stress that things are dynamic. Last week or like 2 weeks ago, I was letting my children have small play dates.
Mm-hmm.
Now I'm not letting them see anyone anymore. So
All right. We're gonna
we
we're
really
gonna
have
get
to
to
be
that. We're gonna
careful.
get to society and panic. That's actually a little bit what I want to lead to. But I have a question, doctor, and I think this is on everybody's mind. You know, there are celebrities and people that have come out and said that they have the coronavirus, they tested positive. And a question that I keep getting when I said that I was going to host this series is there are people who don't show any symptoms. I don't know if you've heard Idris Elba, for example, said he tested positive because he knows that he hung out with somebody who tested positive, but he showed no symptoms. So a lot of people are saying anybody could have the coronavirus and not know it. Do symptoms show eventually, or can you go through a period where you have it, you get out of it, and you just don't know you had it? How does this work? Do we know anything about that as it stands today?
So I would say that almost 80%, Yumna, of people will have very mild illness. Okay,
Okay.
so we are hearing about the severe cases, the moderate cases, the critical cases, but the reality is the majority of people will have mild symptoms.
Mm-hmm.
So although now we are testing more and more and we have a better understanding of the numbers, I think a lot of people are actually going untested because it's unrecognized. So people think it's just a regular cold or they just feel a bit under the weather and it passes, you know, in 2 or 3 days. So there are people who will develop very mild symptoms and like go on to completely
Can you
recover.
develop no symptoms for 14 days, 21 days? Can you have the coronavirus and really have nothing show?
So there are some reports of people who have done the test and had no symptoms, but these are the people that you will not know about, Yumna. So I cannot give you an answer for that
Yeah.
because epidemiologically, they
Mm.
cannot basically count these people because they did not present to medical care. You know what I
Okay.
mean? Because they did
Yeah.
not have any symptoms.
Yeah.
So actually, some people speculate, but again, these are all speculation.